First I would check the order for the patient and check to see if they had any allergies. Then I would assess my patient and assemble my supplies. Then I would wash my hands before and after doing the procedures. I would introduce myself to the patient and identify them using two identifiers. I would provide for privacy, and then I would educate my patient, explain to my patient about the procedure, and then evaluate my patient after the procedure. So I have an order for an NG tube insertion. So first I'm going to explain to my patient what's going to happen. I'm going to do an abdominal assessment on them. I'm going to check their mouth, and then I'm going to check the patency of their nose. I would have the patient blow their nose with a paper towel, and then see which nair is more patent, which one's more, bigger. Make sure that that they've never broken their nose or anything before. So then after that, I'm gonna put my gloves on. I'm gonna make sure and give my patient a cup of water here so that they can take sips as I'm inserting it. So I'm gonna measure from the nose to the earlobe and then down to the xiphoid process. And I'll mark that off with a little piece of tape, just so I know how far down to go. So then I'm going to start, first I would lube this, then I'm going to start inserting it. I would have the patient take sips of water as I'm putting it in, and like push it in as they're swallowing. I would go in. Now I'm going to secure this to the patient's nose. And I would take this other piece of tape off that I had marked with, and I would just mark it with a Sharpie. And then I would have the patient turn their head from side to side, and then make sure they have enough slack to turn their head and stuff, and then secure the tube to their gown. And then I would check for placement, and I would send them down to get an x-ray for that, for the initial insertion, and then anytime after the x-ray, then I could just I could either aspirate the stomach contents, or I could push some air in through a syringe and listen in their stomach with a stethoscope. So then after they come back from the x-ray, I'm going to hook them up to low suction, which is 40 to 60, and I'll make sure that this is patent and make sure that nothing's blocking that.